Hello everyone. Today in series of Docplexus KOL interviews, we have with us Dr. Abdul Jabbar, who is a professor of medicine, diabetes and endocrinology at Aga Khan University Hospital. Today we are sitting in Medcare Hospital where he is working in the endocrinology department. Dr. Jabbar has been a gold medalist throughout his medical career and we are very honored to have him today for this interview. Thank you so much, Doctor, once again for this interview. Let me go ahead and start by asking you some of the questions that our viewers are very eager to hear from you on. Diabetes today puts a lot of pressure on the socio-economic burden worldwide. Due to its higher prevalence, how do you think this pressure can be reduced and the disease can be managed effectively?
So you are very right. It is a big problem, a big burden and a challenge worldwide. But at the same time, coming from the regions where we belong, we see that in the developing world, it's a major problem. It's not one answer to the question you are asking, but I think there are various facets to that. Some of them are easy, like increasing the health awareness. Many of the people with diabetes, they don't know they have diabetes. Those who know it, they are diagnosed very late. Once they are diagnosed very late, their control is not achieved to the target which we are aiming for, and it takes a long time. So they end up with very complications, morbidities, a reduction in the manpower resources, their ability to work, and various factors to that. What can we do for that? Number one is to increase awareness in the masses. And as I say, from the healthcare professional's perspective, it is very important the way I handle it. If I am seeing a diabetes patient, I should ask him or her, what about your next generation, your brothers, your sister, your kids? And one thing which is very commonly identified but usually missed altogether is the weight. Everybody knows their weight. The mother should know that my kids are overweight or not. And if they know it, then it can be diagnosed much earlier. The second factor which I mentioned is, if the diagnosis is made, both the doctors and the patients have to pursue it, that they have to get the treatment to the best what they can. In the earlier stages of the disease, the treatment is easy, the medications needed are not very expensive, the tests which are needed are not very expensive, and the people are healthy enough to walk, to exercise, to change their diet and many factors. At the same time, from the health authorities' perspective in the governments, they should have the resources provided at the healthcare centers so that they're diagnosed early, they're managed very well, and not the very modern, high expensive medicines, but at least the basic minimums should be supplied to all. The last bit I would mention is that people are aware that some of them who would like to do the exercise, but the venues and the parks and the places are not available, where again the healthcare system can provide help.
And in your expert opinion, do you think urbanization affects the rate of diabetes incidence?
Yeah, that's a very interesting observation. So I say everywhere we talk about it, we say, oh, the main problems with type 2 diabetes, which we are discussing now, which is the major bulk of the diabetes patient, is because you are eating unhealthy food, you are not physically active, and then obesity is going on. But when we look into the factors, one important factor is urbanization. And I will give the examples in a simple terms, not in the medical terms. As I say, somebody is sitting in a rural area, many of the people there, even to get their water supply, they have to walk. To get their food, they have to walk. To talk to a phone, they have to walk. So many things involve them into the physical activities, which in the today's world we see as a step count in their phone is happening. But once you move into the urban area, you don't have to even get up from your chair to open the door, to turn the volume up and down, to pick up the phone or anything like that. So urbanization plays a big role. The other side of the urbanization is that those people who are destined to be born in the rural areas or not urbanized area, So their metabolism were designed accordingly even at the time when they were born. That they will be a physically active, not overweight people. And once they move, and that's what we have seen, they move from the rural areas to the urban areas, their size changes. And the machinery which was designed to take care of a 50 or 60 kilogram man or woman is now had to take care of an 80 or 90 kilogram man or woman. So metabolism cannot take care of that. So I think urbanization is very important. And then in the big areas, again, they are very busy. The life is very stressful. They don't have time to walk. And the fast food chains are easily available, even on a phone call, ready to provide you whatever you like. So I think it's a big factor in terms of increasing the prevalence of diabetes, particularly in the regions like India, China, which were counted and still being counted as developing countries. But the masses have moved from the rural or the town areas to the urban areas and the big cities, and it's definitely affecting all these things.
In one of your projects, you studied the correlation between depression and diabetes. So what effective measures, in your opinion, should be taken to avoid the serious disease outcomes?
So again, my dear, it's really, we learned from our experiences. That was something we noted during our clinical practice, and then we designed a project and we worked on that. And again, the most important thing here is that nowadays the healthcare is divided into pockets. So the doctor says, I am a diabetes doctor, I'll take care of your diabetes. I'm not an eye doctor, so I won't take care of your eye. You go to the eye doctor. But in diabetes, which we say is a multifactorial problem where every system of the body is affected, one important thing is stress, anxiety, and consequent on that, depression. So number one, most of the patients will not describe it. They will complain about the things, and all the doctors will say, oh, it's because of your uncontrolled diabetes. So let's control your diabetes. They don't talk about it. The guidelines have mentioned many a times, do a minimum small scale 3-question or 5-question session with your patients to identify if they are depressed. And you won't believe many of the patients when they come to my clinic, and if I give them 5 or 7 extra minutes to talk about questions related to depression, not right to mention, half of them will have tears in their eyes. And if that point I say, don't worry, I'll take care of your depression part as well, rather than saying, oh, go to a depression doctor. They are so happy. And once you provide them support and sometimes medications to take care of that as well, their sugar control, their blood pressure controls, their weight management, everything improves. And just to add to that, because if we are talking about the medicine, if the stress level is high, the cortisol level is high. If the cortisol level is high, they are exercising and not losing weight. And so if you don't take care of that, you won't never be successful.
And in present times, we have noticed that vitamin D deficiency is a very common problem among majority of the population. How do you think this deficiency can be avoided and managed?
Yeah, so about in 2000, I was in my university in Pakistan, and I started looking into those people who came to me with aches and pains, muscle weakness, unable to walk, etc. And I found them to be very low in vitamin D when I started doing the test. When I reported it to my friends and colleagues in the university, they said, it's not possible. So my first data set from 100 people from my university showed that 92% of the ladies were vitamin D deficient. When I reported, they say, Dr. Jabbar, they are all ladies and they are wearing burqa and all these things. I say, I don't think in my university everybody is wearing that. But if I take your argument, in the same data set, 87% of the males are deficient. I'm sure they are not wearing burqa. So that's where the story started. The puzzle today is still so much of the efforts going on. It's being reported in regions like Saudi Arabia and Iran and UAE, everywhere where there is plenty of sunlight. We still don't know what's the exact reason. So for preventing or treating anything like this, which is so prevalent, you need to know first why is it happening. There are certain factors which are identifiable but not proven yet. One is maybe the ultraviolet rays through the ozone layer are not coming through, Or people say everybody is not wearing the burqa, but they are wearing the, what you call, the sunblocks.
Right.
So maybe that's the reason. The newest research on this area is identifying that vitamin D is a fat-soluble vitamin. And if you've got 20 kilogram of extra fat in your body, it goes and sits in the fat. So it's in the body, but not ready to be used. And the more you give, it may get deposited in the fat. So the easiest solution which we are suggesting, to get rid of the fat. And then the sunlight will give you enough of the vitamin D to work on that. This thing came because of the many of the new procedures which are being done for weight reduction. So you do their weight reduction, they lose their weight, and without taking vitamin D, their vitamin D improves. So now for this thing again, as I mentioned earlier, if we don't know the cause, we have got various theories to work on. Number one is keep a healthy diet, keep a healthy lifestyle, try to lose weight, not to gain weight, sufficient exposure to sunlight. And I think the simplest solution in this costly situation now is vitamin D preparation is not very expensive. Vitamin D testing is very expensive. So as we used to give calcium to every woman, calcium to every children, vitamin D to every children, give vitamin D to everybody as a supplement in some form, about 1,000 units per day, and most of them will not be deficient. At the same time, continue with the lifestyle change which I mentioned.
And doctor, in your expertise, what do you think is the relation between thyroid diseases and diabetes mellitus?
Yeah, so this is becoming more and more interesting now. As you know, type 1 diabetes is an immune-mediated disease, and hypothyroidism and both, as well as hyperthyroidism, both are also immune-mediated disorders. So for decades we knew that type 1 and hypothyroidism and hyperthyroidism go hand in hand, and the prevalence is very high. But now there are new reports coming that even with type 2, which is not autoimmune or immune-mediated predominantly, the prevalence of thyroid disorder is quite high. So I just came across recently a few articles in which it was reported from Saudi Arabia, from Jordan, where they reported a prevalence of about 12 to 16% of thyroid disorders in patients suffering from type 2 diabetes. So now it is important for doctors to at least screen them every 5 years or so, although I must admit they are not part of the guidelines yet. But it will come through. For type 1, it's a part of guideline that you should check for TSH to see they are not thyroid problem. For part 2, it's not in the guideline. But we understand on the other side of it is that from the data which is available, that hypothyroid is an insulin resistant state. Hyperthyroidism is a glucose producing state. It leads to hyperglycemia. Hypothyroidism increases the risk of hypoglycemia. So the relationship with type 2 is not very well known, and more awareness will be useful to learn more. And I don't think there is a lot of publication of the data available for type 2, although as I mentioned, for type 1 is very much there. So this was one of the things which I, as you mentioned, worked on, but we have to get a big data set information or more research to be done on this aspect. What is the relationship there or not? It was identified if somebody has got subclinical hyperthyroidism and TSH is suppressed, their prevalence of diabetes increases, which is understandable because thyrotoxicosis leads to increased glucose output and hyperglycemia. So not very sure about it, but the relationship appears to be there.
Thank you so much, doctor, for your invaluable inputs. I'm very sure that our community is going to benefit greatly from the information that you have given us through your answers today. Thank you once again.
Thank you for getting me involved. Pleasure.